For patients that don't have abundance of tissue in their abdomen or they've had prior abdominal surgeries, the gap flap is a great option. The gap flap stands for gluteal artery perforator flap. It's based on the tissue from the buttocks. It's a tissue that's supplied by a small branch of a blood vessel that comes off an artery and vein near the buttock region. So when we transfer the gluteal flap from the buttock area to the chest to create a breast mound and ultimately shape a breast, we use our microsurgery techniques that we use for other types of flaps as well, and we spare the muscle and the nerves that give the buttocks muscle its blood supply and its nerve supply. When we design the flap, we can have it designed in two different ways depending on where your tissue abundance is located, either in the upper gluteal region or in the lower gluteal region. For the upper gluteal flap design, the scar is usually hidden in the underwear line in the upper portion of where an underwear or a bathing suit would sit. For the lower gluteal design, it is based on the lower gluteal crease area, also covered by the underwear or swimsuit line. It is technically possible to do a bilateral gap reconstruction. However, most plastic surgeons and microsurgeons do not recommend doing that all in one surgery procedure. It is a longer type procedure simply because of positioning during the surgery, and the majority of us have a consensus that the best utilization of the surgery and time in the operating room is to do one procedure at a time. When the gluteal flap is taken from either the upper or the lower buttock, it can have some contour irregularities. We try to do our best to minimize that by using our plastic surgery techniques and closing the wound in a way that can minimize the scarring and contour irregularities. Having said that, most patients do not find it to be a significant burden as far as the contour. The main benefit to the gap flap is using your own tissue. It's the same benefit as using other autologous tissue reconstructions such as the DIEP flap, the gracilis muscle-based flaps, or the latissimus flap. So the benefit is you don't have to have an implant-based reconstruction. It's based on your own autologous tissue.